Good morning, everyone. Hope y'all are great. My name is Miss Bethany Gregory, so I'm a STEM coach for Northwest Cabarrus Middle School and Northwest Cabarrus High School. Thank you all so much for joining us today for our career community talks for our STEM program. So today we have a lovely guest with us. Her name is Miss Renee Easter. She is actually a care coordinator, so a nurse for Novant Health, and she's got a very diverse background, not only with education, but also her experience in nursing. So we're going to have her talk with us today about her experiences, not only being a nurse, but also in the medical field. And then we will be recording this. So if there's anything that you missed and like to go back and check, we'll have this video posted for you. And just a couple of things as we go through, we just ask out of respect for everyone's here who's listening, just please keep your cameras. You can have your cameras on because we'd love to see your faces, but just make sure that you're on mute. If you'd like to ask questions directly to Miss Easter at the end, we just ask that you raise your hand and we can call on you there. If we don't get to it, you're welcome to put it in the chat and we'll try to get to you sooner rather than later. So without further ado, here is Miss Renee Easter, our nurse for the week.
Good morning, and thank you so much. It's a pleasure to be with you guys, and I hope that maybe I can help you guys in some way. Some of you, it sounds like, has an interest in medical field or in nursing. I've been nursing for over 23 years as a registered nurse. A little bit about my background. I'm a wife and mother, grandmother, and I have been involved in nursing from my high school. I went to a technical high school in Virginia, and so I did the LPN program my senior year. And then later in life, I went back and got my associate's degree in nursing as well as my paramedic. In the state of Virginia, we had to do the national registry. So at one time I did national registry paramedic along with nursing. So it has been a kind of a diverse and interesting thing for me. It's something that I have always wanted to do and be. So there's several things in life that we go through and we think, oh, I want to do this or I want to be that. And maybe as time goes on and changes, we fall more in love with something in that area, such as the medical field, or we say, wow, maybe that's not exactly what I want. So now's the time to really start looking, gaining interest, and preparing. Because what you do today and what you do from 6th through 12th grade will have effect on your life. You can and will take it with you the rest of your life. So there's things that I thought, why did I have to learn this? Why did my teacher make me apply myself, or why did they make me learn algebra? Well, I use algebra almost every day, so I know. But just a few things about my background. Like I said, I did the LPN program, became a volunteer EMS provider, became a CPR instructor with the American Red Cross and taught first aid and CPR. Then I went into the American Heart and stayed with American Heart because American Heart is what most medical facilities use to teach different certifications that we have to have depending upon your area of expertise or where you work. So I did some of those, and as I became a paramedic, I became a paramedic preceptor, and I precepted paramedic students in the emergency department in Mount Airy, North Carolina. So kind of an overview, I've done anything from what we call cardiothoracic. People have open heart surgery or have problems with their heart. I was a nurse there on that step-down unit. I've done ICU. I've done ER nursing for about 14 years. I've worked in the recovery room and the OR. Worked in the cardiac specialty of a clinic for the Novant Health, and I've been one of those nurses who didn't work just one job. I worked a couple jobs at a time, so I have done school nursing, and I worked as a float school nurse while I worked in the emergency department. And as of now, I do have 2 jobs. I work as a care coordinator for Novant Health, and I'll kind of explain that. And I work as a hospice registered nurse, and I just kind of go into patients' homes. I'm one of those fill-in nurses who works on some of my days off to go in to patients' home to help them during their end of life needs, making them comfortable, but yet making sure that all needs are met, medical and kind of listening, being there, and preparing them for the end of life as well as their families. Um, right now, as a care coordinator, I pretty well get up and start my morning at home, and we now work remotely at home. This is something new that we started since March when we did find out that COVID was being a pandemic, and we were sent home to work and have stayed at home. And Novant at this time has decided that it's working so well that we will continue to be remote nurses. And most all of my work with Novant is on the computer and on the phone with patients. Contact patients on a daily basis, educate patients, and check on them once they've been discharged from the hospital, whether it's been a hospital admission, whether they had an injury, an illness, a surgery. And we also contact patients who've been in the emergency department. As well, we work alongside in what we call payers, and as insurance companies. So most of mine are Medicare patients. They're the older population, and we contact them for educational purposes and encouragement to keep them involved in their health so that they have a better quality of life. Maybe they have a longer life, and we try to get them in with physicians, get referrals done, get them to places they need to. And maybe there's things at home that they don't have that they need. It might be anything from food. It might be the inability to get medications because of cost. It might be something that they need a caregiver, home health, or a sitter. And we do have people within our care connections who work in pharmacy, who are social workers, and we have funding and the ability to help some of those during those times as well. So it's pretty diverse. It's a type of nursing that I never knew existed. I've always been a hands-on, face-to-face nurse in the hospital or in a doctor's office and clinic. And I've always given bedside care or patient care on medications and assessments one-on-one. And so this is a different assessment. It's really opened my eyes up. And that's one thing I want you guys to know is in the medical field, there are so many different positions other than just nurses. I have been involved in emergency medicine through EMS as volunteer and paid. I have family members who are EMTs, paramedics, doctors, LPNs, and we all are working together for the betterment of the patient. It's a team effort. So no matter what level of care in a hospital, from housekeeping on up to the best surgeon, we couldn't do it if we didn't each have a job to do and a duty to act with compassion. So I just want you guys to realize that there is so much out there that you can do to become something in the medical field. Say, oh, I'm going to be a nurse or a doctor, and once you start it, you don't care for it, but you will find something that fits you, and you'll be great at it. So where do you start now? Where do you start when you're in the 6th grade, the 8th grade, or the 10th through 12th grade? School, education, gaining knowledge. Some of the things that are important are English. Wow, a lot of us hate to write papers. We hate to do research. We don't like to go search and research and do reports. But English is very important language that we use. We need to know how to explain things in terms that people can understand. We may get some highly educated people, but we also may have some who are illiterate, can't read, cannot write, but we can bring that to them in a knowledge that they can understand. We need to know how to basically everything that I write has to be written properly, and I have to know how to spell because if it's not spelled correctly, it could mean something different. It could have one meaning in one area and a different meaning in another area. So they, as a organization, will tell us what is allowed and what is not allowed. Abbreviations are one thing that we really crack down on because I can write one abbreviation and it means something for the heart. Someone else can write that same abbreviation and it means something for their expertise. So we have to come together and say, okay, we can and cannot use these things. So it's real important, and that really comes to play where we learn a lot of it in English. Math is some for a popular and very easy a very easy thing to learn. My son did great in math up through 4th, 5th grade. Then he had some problems with specific types of math. But once he got over that hurdle, he did excellent in geometry. And he can throw out angles and measurements and everything, and I'm in awe because I'm not able to do that as well. Whereas I functioned well and did algebra well, and I use it every day, and I'm thankful. I have a nephew that no matter what kind of math we give him, he's really good all the way through calculus and everything, and he doesn't understand why we don't understand what he understands. So depending upon what you want to do in your career will depend upon what you need. But preparation is one of the number one things. So getting your math in, getting the skills in that you need from algebra, maybe pre-calculus, to the sciences. If you want to go into teaching or if you want to go into a medical field, the sciences are very important. You need biology and chemistry, even physics, and you guys are blessed in your schooling that I understand that you have the opportunity to take physics. Not all schools or high schools have that ability. So those are real important. Health occupations, if you have the ability to take that, kind of gives you a baseline of different things in the health field and things that you can learn. Sometimes as a school, CNA, Certified Nursing Assistant class is taught, and you can become a CNA by the time you're out of high school. Some it's not taught in high school, but is available for high school students elsewhere. So don't confuse that with a CMA. CMA is a Certified Medical Associate, and they are the next in line as a licensed practical nurse. So there's many things as far as where I came from. I did the CNA. I went through LPN. I did my associate's degree in nursing, and then you go forward and you have the bachelor's in nursing, and you have the master's in nursing. Once you become a bachelor's, you're more able to become more of a leader in most places. And from bachelor's on up, you can do master's in education of nursing. You can do nurse practitioner. You can become a certified registered nurse anesthetist and work alongside patients in the OR giving anesthesia. So there's multiple areas, as well as becoming physicians and surgeons, and Novant even hires paramedics to work in the hospital with cardiac catheterizations. So you don't have to just fit in one area of the medical field to be able to do many things. So I guess the most important things that I would give you as advice is don't ever not believe in yourself, because you can and will be what you want to be. Just because someone else says, oh, you're not going to do that, or you can't do that, that doesn't mean that you can't and will not. You have to have that faith within yourself, and you can and will do.
Uh-oh, Miss Easter, looks like you somehow got muted. I'm sorry. There it goes.
Okay. Sorry. Be open-minded. Be listen to others. Maybe shadow some people. and pay attention in class. I know sometimes it's hard to do. It's hard for me to do even today as an adult. But look into the options that you have. What are the different options that you have in your school to prepare for what you want to be in the future? A lot of those same classes that I mentioned is important. The sciences, the English, the maths are also important in many other things. And I think that's why a lot of colleges, whether it's a community college, university, or pre-med, have that expectation for you to get these things done before you get accepted into whatever field you want to go into. For example, my nephew went to school. He took an extra year of school kind of because he needed to know what he wanted to be. He had made his mind up. He changed his mind. Now he works, he is a physician, but it took him about 2.5 to 3 years while he was in college at the college level to decide what area he wanted to go into. Prepare by taking the classes that's available and while you can, and explore your options and research, ask questions. So those are important things that I would encourage you to do, and just do your best. Just try to do your best, and don't feel like, oh, I'm a C student that I can't do this, because some of the best nurses and doctors and all have been anywhere from an A, B, C student. I just expect you, as I would expect my son, to just do your very best and to apply yourself. I do hope that, things that I've encouraged or said might be helpful to you guys. I have loved my job. Get up every morning, like I said, and I just basically sign on the computer and I start reaching out to patients and talking to them and educating. A little on the hospice side, I actually go, like home health, I go to hospice patients' homes. So I contact the patient to say, I'm coming today. Is this a good time? And then I go into their homes. Sometimes they call because they need equipment. They need help in finding out information. They may need help because they're sicker today or something's going on that's different. So I always have to be prepared. I take supplies with me. I compute to work in my vehicle, and or I commute to work. I apologize, in my vehicle, and we do use laptops for our charting, same as we would in the hospital. And there's different things. I always assess my patient. I talk to the patient and the family, and then we see what needs are met. And a lot of my talks with them do have to do with the end of life, and that is something that at one point in my life as a nurse, I thought, well, I would never be able to do. But it is a very rewarding job, and they are very thankful that we give them that opportunity to express their needs or their feelings and make amends to things that happen in life before they're actually prepared to go on to the next part of life. I do hope I've been a help, and if you guys have any questions or anything, I'll do my best to answer them. And I will turn that back over to Miss Bethany there and let her tell us where to go from here.
Yes, fantastic. Thank you so much, Renee. And first, also, thank you so much for sharing too about the importance of preparing for education 6 through 12. And that is just really good to know that, students have a diverse opportunity when they get out of high school to go in various different avenues of nursing, rather than your typical just you have to go always a 4-year degree or plus. So I love it. So students, if you would like to ask a question, feel free to raise your hand, and we'd love to see your face as well if you want to turn on the camera and ask Renee a question that way. Or you're welcome to put a question in the chat. So students, feel free to go ahead and do that now. Okay, Tabitha?
What office does she work at?
So right now I work for Novant Health. It is called Care Connections, and I'm actually working out of my home. I was in Winston-Salem, but I work out of my home. As far as hospice, I work for Mountain Valley Hospice in Hillsville, Virginia, and Mountain Valley is out of Surrey County.
Okay.
Thanks, Tabitha. What other questions do we have? I know that a student had actually asked me earlier, they wanted to know a little bit about your experience in the ER, like what stood out the most.
I think the ER for me, and it's still a love, is that any day that you go into the emergency department, you expect it to be busy, but you never know what's going through the door or coming through the door. So it's always an opportunity to learn and apply new skills, and as well as enhance the skills that you already have. To me, it's probably one of the better places as a medical professional to work and stay in tune to what's going on and see the changes. And I think that's it. And you get to see all walks of life and realize that all people, though they may be different financially or culturally, are basically the same, and that we should give our all to make them healthier or to help them during that time of need.
Thank you. We have a question from London. How many years did it take you to be, well, they said a doctor, but nurse. So how many years did it take for you to be a nurse? And then they wanted to know, do a lot of people get rushed to the ER every day?
Okay. Well, as far as nursing, if you want to become a CNA, a certified nursing assistant, it's like 12 to 15 weeks. And then you can get a CNA too in North Carolina. I did it back in the day when it wasn't like that, and I kind of got grandfathered in because in my LPN program, I started working as a CNA. But the LPN program is approximately 15 months long. The associate degree program is like a 2-year college degree, basically. But if you get your Englishes and your prerequisites in, it can be 2.5 to 3 years. For your bachelor's degree, it's basically a 4-year program. Master's is 6-year program. You can now become a doctorate with as a nurse. You can get your doctorate in nurse education, doctorate as nurse practitioner. So you are looking at probably 6 to 8 years for that. As a provider, as a medical doctor, you're looking at least for a family practitioner 8 to 10 years, depending upon any expertise or anything. That's just for family practice, though. Emergency department, yes, people get rushed to the emergency department all hours of the day. They come by ambulance. They may walk in some of your inner cities, and they are brought by vehicle. Some of them are very minor things, and then some of them are just chronic illnesses that get worse. Some of them are new sudden onset, like I'm sure a lot of you've heard of an appendix, and all of a sudden somebody's hurting in their stomach. They come to the hospital and they have to go to surgery and have that appendix removed. So it's a wide range of things that happen on a daily basis, and anything from a stub toe to a really bad trauma or a need for surgery you'll see any day at any time.
Okay, thank you, London, for that question. The next one comes from Author. He wanted to say, would you say that it's important for new nurses to start out in the ER to gain experience, or can they start in their specialty?
Well, years ago, you had to do like med surg is what we would say, the medical surgical floor, which would be any medical illness and those who've had surgery. You used to have to do 2 to 3 years, but now they see that it has benefited for you to learn as a new nurse straight out of nursing school. If you wanted to specialize and go into maybe the heart and the cardiac, ICU, and ER, they are bringing you in and they are precepting you or orienting you to that floor maybe for a longer period of time, that you are learning the basics as well as what's very important in that specialty. I myself did not get to do that. I had to work my couple years to get to the floor, to the ER. I see benefits both ways. If you want to continue in emergency medicine, and they will hire you. I am all for it, same as ICU. That gives you the benefit to learn so much at one time. But never stop learning in that specialty. Always kind of look out into the field and see what's changing and all as time goes on.
We had another question from Daya. They were asking about, once you complete your 4 years of school, is there any additional schooling or education needed in that field? I know you said if you were interested in master's, you could continue, but perhaps you could tell us, like, if once you receive practices, do you have to either go back to school or maybe you have to keep up with credits, or how does that work to keep your license?
So basically, once you finish your 4 years, you do have to, whatever state you're in, have to set 4 nursing boards. Those nursing boards are now all online, and so you would set for what we call the NCLEX, and that is your licensure. Once you've taken that NCLEX, you learn whether you pass or fail. You do get chances to retake, but once you've passed your NCLEX and got your licensure, you are ready to go to work. If they need you to take anything further, they will usually they give you like 6 months to a year to obtain those certifications. Some of those certifications are, some you would already have. One would be CPR, basic life support. So they would do you a class in that pretty quickly if you had if it had expired or if you needed that certification. Some others would be ACLS, which is Advanced Cardiac Life Support. So to work in the ER, the ICU, recovery room, things like that, you need those extra certifications to teach you emergency medications in situations that you would have to use those in quickly. Pediatric advanced support is also one of those, and it is like the advanced cardiac life support. It is just in tune to pediatrics, to children and their care. So if there's ever a need for any of those extra ones when you're hired or before you're hired, they tell you and they will help you get those. Generally, most of them will pay for you to do those.
Fantastic. Thank you. All right, students, in the interest of time, we have just a couple of minutes left. Are there any more questions that you have for Miss Easter? Again, you're welcome to raise your hand or you're welcome to type it in the chat. Any other questions? Okay. Well, if we don't have any more questions, again, if any other questions do come up, students, please feel free to contact any of us STEM coaches, and then we can get your questions to Miss Easter in hopes that we can get all of that answered for you. So without further ado, everyone, thank you so much for joining us. And Miss Easter, thank you so much for taking your time out of your day, because I know you're very busy, especially on the clock. I mean, this has been very enlightening, and I know a lot of students were just very interested in learning more about nursing and the education side of it, your experience, and then, of course, post-education it's all very valuable. So thank you very much.
You're quite welcome. Thank you so much for having me. You have an awesome group. I really appreciate it.
We appreciate it. We love our STEM students, right, guys? You guys are awesome. All right. Thank you so much again. Everyone have a fantastic day. And Miss Easter, I'll be sure to send you any questions that we might receive.
Okay, that'll be great.
All right.
Thank you. You have a good day.
We appreciate it. Thank you. Bye, everyone.